Good morning, friends. Welcome to Dr. PM Times. This is Dr. Murugesan. In this episode, I am going to focus on another common problem faced by the obese, which is called fatty liver, which is very common nowadays. You don't know that you are having a fatty liver, which is common, especially in Indians who indulge in carbohydrate based diet. So they go for a routine ultrasound. Accidentally, they come with a finding they have grade 1 fatty liver, grade 2 fatty liver. So they get panicked and immediately consult a physician. What is this? So nothing to panic here. Simple steps can prevent or make you get back to even from grade 3 fatty liver to normal liver. So my idea is to focus on what is fatty liver first, what causes fatty liver, how it progresses. Then I will tell the remedial steps also. Fatty liver, as like any other metabolic disease, is common in obese. It is a manifestation of metabolic syndrome. People with metabolic syndrome or insulin resistance are prone to have this fatty liver. Obese people who have all the symptoms or signs of insulin resistance, who have all the criteria for metabolic syndrome, fatty liver is the common presentation. It is as common as 60 to 70% incidence in obese compared to just 20 to 30% in normal. So it's very common in obese or overweight individuals. Now, what causes fatty liver? Fatty liver is due to excess triglyceride deposition in the liver cells. As you all know, when you take food, we observe glucose, and this glucose is used as a source of energy after food. Whereas in between meals, when food is not available, fatty acids are used as the main source of energy. What we do is we take more than what is required, and this excess glucose is stored as triglyceride in the adipose tissue. The triglycerides get broken down in the adipose tissue, converted into fatty acid, and they are taken to the liver. So the excess fatty acid load to the liver getting deposited in the liver cells, which are called hepatocytes, leads to fatty liver. Number two, the excess fatty acid derived from the excess glucose that we take because of a shunt pathway called HMP shunt. The excess glucose first converted to glycogen, and more the glucose that we take is converted into fatty acid. So the excess fatty acid derived from glucose that we take as carbohydrate also get deposited in the liver. These triglycerides are meant to be stored only in the adipose tissue. Only the adipose tissue is capable of handling these triglycerides well. The excess triglycerides from the adipocytes get spilled over, then it goes for storage in the liver cells, which are not professionally capable of handling these triglycerides. It is the fatty acid that is stored as triglyceride. So because of accumulation of triglyceride in the liver cells, this problem of fatty liver occurs. Also, the liver cells is not able to oxidize the excess fatty acid that is accumulating due to the toxins released from adipose tissue. In truncal obesity, what happens? The adipose tissue releases a lot of toxins called adipocytokines, especially tumor necrosis factor alpha, a substance. This toxin can act on the liver cells and they impair the liver cell activity of oxidation of fatty acid that reaches the liver cell. So there occurs a two problem. Excess fatty acid is now mobilized from the adipose tissue to the liver cell, number one. Number two, the fatty acid that is mobilized cannot be oxidized by the liver cell because of the toxin that is also released by the adipocyte. So more fatty acid reaches, less fatty acid is oxidized, leading to fatty acid accumulation in the form of triglyceride in the liver cell, which in due course becomes what is called fatty liver. It is commonly known as non-alcoholic fatty liver disease because it affects even the non-alcoholics. So don't say that I am not taking alcohol, I am not smoking, why I am getting problem in the liver. Doesn't mean only alcoholics can get the liver problem. Even a person who is non-alcoholic, not smoking, but he indulges in excess carbohydrate intake, he is obese, can have this fatty liver. So what happens because of this fat accumulation? So first, as I said, he develops fatty liver. Then as the course of time, he develops inflammation. The inflammation is due to the oxidation stress induced by fatty acid. It is also due to the gut-derived endotoxin. It is also due to the adipocytokines released from the adipocytes. All these can cause inflammation. So they go on to the next stage, which is called non-alcoholic steatohepatitis. First, it is called steatosis. Just accumulation of fat is called steatosis. Once they develop inflammation, it is called steatohepatitis, which is the next stage. Then they cause, they end up in even liver cirrhosis. It is due to the damage of the liver cells being replaced by fibrous tissue. Once the liver cell is damaged, it becomes replaced by fibrous tissue. Excess fibrous tissue as a repair of fatty acid damage of the liver cell can lead on to liver cirrhosis. Liver cirrhosis is an irreversible problem. Fatty liver is very much reversible. Non-alcoholic steatohepatitis, the next stage, the inflammatory stage, also you can easily reverse. Whereas once the person enters into the cirrhotic stage, when fibrous tissue replaces the normal liver cell, it becomes irreversible, very difficult to correct after that. And rarely few patients can even end up in liver malignancy, which is dreaded, which is fatal. So that is why we have to focus on early correction of fatty liver grade 1, grade 2, grade 3 to normal liver. How to do it? As I said, the person suffering from fatty liver doesn't have any severe signs or symptoms. He is normal, he is obese, truncal obesity is present. He has a habit of indulging in carbohydrate diet predominantly. He takes intake is more and his expenditure is less, doesn't have any physical activity, he doesn't have any much of muscularity. So such individuals we should suspect of fatty liver. It is an incidental finding. He doesn't have any symptoms. He doesn't have much complaints initially. Grade 1, grade 2, he doesn't have any complaints. He is absolutely normal, moving around. Only thing is obese. Rarely he can have a right upper quadrant discomfort. That is where the liver is situated. Otherwise, he is not. So such persons, you do an ultrasonogram as an incidental finding. When you do it for some other ailments, usually we diagnose grade 1 or grade 2 fatty liver. Then how to, once a person comes with the ultrasonography, he becomes panic and he comes to you, then you have to intervene at that time. Simple corrective measures can reverse fatty liver even back to normal liver within say 3 to 6 months period, because the liver cell tissue has high regenerative capacity. It can repair and get back to normal easily. As we discussed, we understand that fatty liver is common, especially in South Indians who are mostly carbohydrate based diet. So how to reverse this problem of fatty liver, which is so common nowadays, even in non-alcoholic? I said it is a non-alcoholic fatty liver disease. It is very simple. Eat healthy is the key. Avoid refined carbohydrates. Take complex carbohydrates which are fiber rich. Avoid frank sugars or added sugars, the sugar that you add in tea, coffee. Avoid sugary beverages. Reduce the saturated fat and trans fat intake, which is common in bakery foods, packaged foods, processed foods, animal foods such as cheese, butter, etc. As much as possible, avoid this. So if you do this, further damage or progression can be prevented. Then how to reverse this? It can be easily reversed by replacing the food with the superfoods. Take superfoods as much as possible. The important superfoods I would like to mention is, number one is garlic. Garlic is a potent detoxifier. It helps to reverse fatty liver to normal liver easily. Number two, add as much as cruciferous vegetables, especially broccoli, which are fiber rich, which is helpful to reverse fatty liver back to normal. Number three, use olive oil for cooking, which is also very, very helpful to reversing. Then number four, intake of fish oils, say cod liver oil, sardine oil, will be very, very helpful to reverse fatty liver back to normal. Green tea consumption is also helpful. Beetroot is supposed to be a very good superfood and detoxifier, which is rich in nitrates, which is helpful not only for reversing fatty liver, it is also helpful in atherosclerotic coronary vascular disease also. Also, take as much as fruits, especially citrus fruits. Say add lemon and oranges in your day-to-day routine. All these are supposed to have a high regenerative capacity. Liver cell as such has got high regenerative capacity. All these superfoods add to the regenerative capacity so that a person even with grade 3 fatty liver can be easily reversed back to normal liver in a span of say 3 to 4 months. Then indulge in aerobic exercise activity of at least 150 minutes per week. Then avoid alcohol. You should stop alcohol. You should quit smoking and don't take unnecessarily the drugs without prescription or consulting a doctor. So by all these basic steps, you can easily revert a person in fatty liver, even grade 3, grade 2, back to normal liver. Thank you.